Welcome back to West Texas View.
Welcome back to the West Texas View. I'm Johnny Lou Avery, and Dr. Melinda Morris has been talking to us about some of the things that we need to know in the urological functions of our body, and particularly as we talked about some of the problems that happen with the bladder. And I was asking her at the break to tell us some of the things that we need to avoid in order to have a healthy bladder and a healthy a lifestyle in our urological functions.
Well, when ladies present, with their bladder symptoms, we go through a detailed bladder history, which lets me know, what triggers their symptoms, how much caffeine intake do they have, because caffeine is a diuretic and a stimulant, and so it's going to increase urine output. It can increase irritability of the bladder. Teas especially can cause those symptoms. Artificial sweeteners can. Carbonated drinks can cause bladder irritation. Smoking can, over time, lead to bladder issues. Excessive weight gain, just from the added pressure, abdominal pressure on the bladder, can put you at increased risk for leakage and incontinence problems. So we go through a detailed history to see what their risk factors are and see what could be contributing to some of their symptoms. Certain medications that you're taking will contribute. If you're on a diuretic or a water pill, you're going to feel like you're just going to the bathroom all day long because of that. Some women just drink a lot of water throughout the day, so they're going to the bathroom frequently just for that reason. If you're a diabetic, you're going to have increased urine output. So we have to look at medical conditions, lifestyle conditions, any medications that they're on that could be contributing to some of their symptoms.
But the carbonated sodas are really something to be avoided.
Yes.
But caffeine, you wouldn't have to completely cut out caffeine.
Oh no, we can't completely cut it out. But if they're drinking, probably more than 2 cups of coffee a day, or 2 or 3 cups of tea a day, that could be contributing to some of their symptoms. So
in citrus juices, some people find that.
Well, the acid can be irritating, and there are people with a condition called interstitial cystitis, which is a very chronic, painful bladder condition. And these women present as if they have an acute urinary tract infection. They've got painful urination, they've got urgency, they've got frequency to where they feel like they're needing to go to the bathroom all the time, but then a urine culture is done and there's no infection there, but they continue to have the symptoms. And it's actually a condition that's almost similar to gastric ulcer disease, where the lining inside the bladder has worn thin. And so if you take in any drinks or foods that are high in acid or real spicy foods, that can actually irritate the bladder.
It's almost like having an ulcer in your bladder.
Yeah, it's like having an ulcer in your bladder, and actually the treatment for that is almost like an ulcer medication that rebuilds that lining inside the bladder. And so, women, have to modify their diets if they have that condition.
But when you're talking about a woman modifying her diet, that's not really easy to do.
No.
But like drinking a lot of water, somebody that's a runner that drinks a lot of water, can you drink too much?
Well, technically you can drink too much. You can drink so much that you affect the electrolytes in your body, but most of us aren't going to be guilty of that. There's actually a medical condition that causes you to overdrink water, and they're the ones that really have the medical complications from that. But we all need to be drinking at least 8-ounce glasses of water a day, and very few of us do that. We're drinking soda, we're drinking tea, and we're drinking coffee, but we're not drinking water. But water is very healthy for the kidneys and the bladder. So that's part of the instructions as well, is to make sure that they're drinking plenty of water daily. Cranberry juice is always felt to be healthy for the bladder as well.
Well, tell me exactly what a yeast infection is. Is that an infection of the bladder or the urinary tract, or what is it?
Well, it can be. Yeast is part of the normal flora in our gut.
Right.
Okay, so there's always some yeast there. Certain foods will actually increase the production of yeast in your body. And then yeast can contaminate the vaginal area, it can contaminate the bladder area as well. And women are especially prone to that. But yeast likes sugar. So anyone that has a high sugar, high carbohydrate diet is going to be at greater risk for recurrent yeast infections.
Okay, so it has nothing to do with something external like sexual intercourse or anything like that?
No.
It is strictly something that's happening within your body.
Within your body, yes.
And so then when you, now there's so much over-the-counter medication for yeast infection, but what if you're treating what you think is a yeast infection and it's not that?
Then you need to call your doctor.
So if it keeps on, if you use a tube or whatever the amount is.
Yeah. If you're using the over-the-counter medications and your symptoms are not improving, then you need to contact your doctor, because other conditions can mimic, a yeast infection. Yeah, so you need to go in and be evaluated to find out for sure what's going on.
Well, what is the number one frustration you have as a gynecologist with women? Is it that they don't seek help soon enough? Or is it that they don't listen to what you say and keep on doing what they were doing?
Well, women are pretty well educated these days. Thank goodness for the internet, and they're on WebMD. They're checking things out. So a lot of times they're coming in with a lot of information. And they want clarification, on what they've read. Unfortunately, not everything on the internet is correct. So sometimes
specific
to them. And they may have symptoms and think they have this condition, but there's other conditions that would have similar symptoms. So a lot of it is just educating them on that. But I think women are becoming more and more aware of how important it is for them to stay healthy, and they're really seeking that. They're seeking the advice that they need to stay healthy.
And you said a key thing a while ago when you said quality of life.
Yes.
We don't want to go on when there's lots of things that we can do to give us that quality of life. We're going to have to take a break right now, but we'll be back in just a minute and continue this conversation. Join us then.
Stay tuned. West Texas View will be right back.